Hi, everyone, and welcome to Breaking the Silence podcast produced by Angels Protection, Inc., where we uplift the voices of young mothers of color and the advocates, healers, and champions fighting to ensure they receive the care, dignity, and justice they deserve. I'm your host, Makaila Davis, founder and chairwoman of Angels Protection, Inc. In this special episode of our Women Leader series, we are highlighting women who choose leadership in transforming the landscape of mental health, public health, and every and all systems that shape our everyday lives. These are women who are quietly and boldly changing the world. So today's featured guest embodies the power with compassion, brilliance, and unmatched expertise. So I want to just kind of get into her introduction here. Dr. Amanda E. Williams, she's a board certified adult psychiatrist known for her rare ability to integrate psychopharmacology with deep, meaningful psychotherapy. She believes in active collaboration with her patients, always working towards healing and stability while reducing the need for psychotropic medication when appropriate. A balance few practitioners master as beautifully as she does. Dr. Williams received her bachelor's degree in integrated life sciences from Kent State University and went to earn her medical degree from Northeastern Ohio Medical University. She's trained in adult psychiatry at the Medical College of Virginia, where she served as chief resident, demonstrating exceptional clinical leadership early in her career. She entered private practice in 2002, specializing in cognitive, behavioral, psychoanalytic, and supportive psychotherapy in combination with medication management. Before relocating to Georgia, Dr. Williams served as the director of Consultation-Liaison Psychiatry at Akron General Medical Center and as an assistant professor of psychiatry at NeoMed, where she directed the psychiatry resident clinic and was awarded Teacher of the Year. She is certified in cognitive behavioral therapy by the Cleveland Center for Cognitive Therapy, a fellow of the American Psychiatric Association, a member of Docs for Patient Care, and a recipient of the 2012 Patient's Choice Award for being one of the Georgia's favorite physicians. She's well credentialed. And Dr. Williams, she brings decades of wisdom, clinical precision, and heartfelt dedication to mental health. And we are honored to welcome her today to the Women Leader Series. So I just kind of want to just welcome you again. And if you want to say any few words about
Thank you so
that.
much. I appreciate you having me. I'm excited to be here.
No, definitely. And I just really kind of want to just kick off and ask you to begin, what first inspired you to pursue psychiatry and specifically this integrative approach to care?
The most significant influence, I would say there was probably two. I grew up in a healthcare family. Both of my parents pursued nursing degrees later in life. So they were both nurses. So growing up as the youngest of their children, um, healthcare was like anything and everything as far as like the topic at the dinner table and what everyone was doing for their, living at that point. So the exposure to it, of course, is a big factor, just as healthcare field in general. But what specifically influenced me the most to pursue psychiatry was my experience as a freshman in college for one of my psychology 101 type freshman courses. I took it over the summer and they sent us out to different locations to shadow and kind of get experiences in different settings. And I ended up at actually a state mental hospital for the summer, shadowing psychiatrists that work there and the multidisciplinary treatment teams that work there, and just kind of observing how all that went. And it left quite an impression on me. I was already certain that I wanted to go to medical school, but I wasn't sure about what specialty. But that experience definitely brought psychiatry to the forefront of my mind. I think the biggest impact was seeing how interesting some of the situations were that the patients were in, but also seeing the progression of how people improved with treatment, some of whom were even able to be discharged, by the time I was leaving for the end of the summer.
Oh, wow. Um, so I think like doing that early on like really
Mm-hmm.
helped shape your
Definitely.
trajectory for psychiatry.
Mm-hmm.
Um, and that kind of like ties into my next question. So like your career, it spans private practice, academic medicine as well, and hospital leadership, and also your psychotherapy certification. So how do these different environments, avenues, shape the way that you practice today?
Well, I think being involved in a number of different settings has just exposed me to all sorts of different aspects of mental health treatment, different types of patients, people from all different walks of life. all different types of issues. I think just having a variety of these kind of experiences is great because it prepares you. um, I say, that there's never a dull moment in psychiatry, and that every person's situation is unique, every story is unique, everything that you see is unique. However, once you gain enough experience in these different settings, you feel prepared. You feel like you can kind of handle whatever comes through the door, so to speak. And even if you don't know something, you have a better sense of what you don't know. And so you know when to refer, you know when to make other consultations, you know when to handle it yourself and how. And it just kind of gives you confidence in being able to do that regardless of who comes through the door.
No, that's amazing. So just like really looking at everybody as an individual,
Mhm.
um, and not like a one size fits all for care.
Exactly.
Um, so that like ties into my next question. You believe deeply in collaborating with patients and minimizing medication when appropriate. Why is that philosophy so important to you? And what does patient empowerment look like in real practice?
Well, I think that although it's changing and has changed significantly just in my lifetime, the stigma that is associated with mental illness is a big reason, a big factor as to why some people don't feel comfortable pursuing treatment for it, or they don't feel comfortable around people who may have mental health issues, etc. I think that is a big factor. Um, I I like to think of myself as helping to set a good example for accepting people as they are and where they are, and showing empathy to them, and trying to chip away at that stigma, which I kind of see as one of the big barriers, especially in the Black community and in some other disadvantaged communities. There is a cultural significance to it where we often are taught, pray your way out of it, or give it to God, these kinds of things. And there's also a tendency, particularly for Black women, to feel like they need to be the strong ones. They need to kind of hold everybody up and hold everything together. And it seems, I think, in many instances, is a weakness if you do have emotions that are intense, or if you deal with things like depression or anxiety. Sometimes it's hard to share those things with people. And I want to, create a situation and environments where people feel more comfortable opening up.
No, definitely, and that it's safe to receive that help.
Mm-hmm.
Um,
Yes.
Especially like you said, like within the Black community, like especially for Black women,
Mm-hmm.
be strong.
Mm-hmm.
Like you don't need help. You're
Mm-hmm.
okay.
Yes.
You
Yes.
just keep working, and as long as you're working, that's you like getting help,
Mm-hmm.
if that
Mm-hmm.
makes sense. And it's sad because then you're feeling all of those stressors, and then you have those like major like breaking tipping points, um, where then somebody may end up like 302ing you because you
Mm-hmm.
just can't handle it anymore, and that's like that last resort.
Right.
uh, yeah. So
Mm-hmm.
um, no, I could definitely like agree with that. Um, and then like also too, you specialize in combining psychotherapy with psychopharmacology. So can you share like why this integrative model is critical for long-term recovery?
Well, most psychiatrists focus very much on psychopharmacology and other kinds of physical interventions for mental health issues. There's a small minority of us that still hold on closely to our psychotherapy roots. And I think that the healthcare system has kind of created a situation where it's harder to do that. So fewer people end up practicing both. But I think the main advantage of integrating those is that someone doesn't have to see two different people. And sometimes they'll be seeing a therapist or counselor or psychologist. They'll also be seeing a medical doctor, such as a psychiatrist, or maybe a primary care doctor to prescribe their medication. To be able to do both of those together when we know people get the best results when they do both, is a unique opportunity, I think, to really make a difference, with the patient as opposed to splitting up the care, between multiple clinicians.
So folks would be able to just receive all that care with just a psychiatrist
In
versus
in
maybe,
in some instances, yes. The way that I practice and have chosen to practice, yes.
okay, that would be more better and efficient for
And
folks.
many people find that, yeah, find
Yeah.
that helpful, efficient, and it saves having to get to know a whole another person, and of trying to coordinate care between multiple people when things need to be addressed. It's kind of like one-stop shop.
No, and that's a blessing that you do that type of care. Just because when you're having to tell your story over multiple times, it could get tiring, and then that second person that you're telling the story to might not receive it the same way that the first person is. So that could like also be daunting depending on like who the patient is.
Yes, it's true.
So, yeah, no, that definitely makes a lot of sense. Um, so what are like some misconceptions people have about psychiatric medication and therapy that you wish more communities, especially Black communities, understood?
Okay. Well, again, I was mentioning earlier about stigma. That's a big one. There is a tendency, especially in the Black community, to think and want to kind of label people, oh, she's crazy, that kind of thing. I think what's important to know is that, unlike what many people may think, most of the medications that we use are not addictive or habit forming, for instance. Many people are concerned about the possibility of that when dealing with medicines. But again, most of the ones that we use for the most common types of issues that people have around depression and anxiety are not addictive or habit forming. So that's a big misconception. There's also perhaps a misconception about how psychotherapy works and how long it takes. Um, Traditionally, decades ago, in a more of a psychoanalytic type of therapy, it was a multi-year process, multiple days a week, sometimes, very intensive type of treatment over a long period of time. However, in more recent years, we've developed some models of psychotherapy that are more efficient, really, and time limited, and allow people to accomplish a lot in a much shorter period of time. It's one of the ways in particular that led me to cognitive behavioral therapy, which is, if you will, one of my favorites, as far as the different types of psychotherapies that you can learn, because it is very much focused on how can we approach this problem directly and quickly and efficiently in a very pragmatic, practical way.
No, that makes a lot of sense. And kind of like to touch on that, like
Mm-hmm.
a lot of the psychiatric medicines, they're not addictive.
Mm-hmm.
And I think a lot of most folks think that it is.
Yes.
Um, so that's like really good that we're breaking that barrier
Yes.
today and letting
Yes.
folks know that
Yes.
that it's not and it's
Yes.
okay to receive help and care.
Yes.
Um, so also too, like how do you approach treatment for patients who come to you carrying complex trauma, stigma, or fear of mental health care?
It's really about building rapport, about building that relationship. There's been a number of research studies over the years that have shown that it essentially doesn't matter what type of therapy is used. The most important factor in people getting well, getting healthier, and healing is their relationship with their clinician. And so the key is to focus on building that rapport, building that therapeutic alliance, collaborating together. It's not one of these old fashioned, if you will, paternalistic models where, okay, do what I tell you to do, kind of thing. It's more of let's approach this problem together and how can we solve it together. So again, the relationship is the most important factor.
No, definitely like a lot of collaboration, working together,
Mm-hmm.
building that trust.
Yes.
Um, like you said, like the stigma.
Mm-hmm.
Like there's so much stigma surrounding mental health, and people are seeing a lot of things on social media,
Mm-hmm.
especially TikTok. A lot of the younger generations on TikTok, so they get a lot of their information from there.
Mm-hmm.
Um, so yeah, I think it's like just great, like even like today having you on here to kind of like,
Yeah.
break that stigma and, how folks are viewing things when it comes to psychiatry. Um, so like as a leader in psychiatry, how have you seen the mental health field evolve in terms of cultural humility, inclusion, and also patient-centered care?
Well, one of the ways that I have seen maybe one of the most effective sort of changes that's occurred over the years is a better understanding of how law enforcement interacts with people with mental health issues. There's been the development over the years of very explicit training, for instance, for police officers who are often the first responders to a mental health crisis, to help them understand better how to deal with people who are having a mental health crisis. We've all seen the headlines and seen the stories of times where police have been called because of a mental health crisis, and things have not turned out very well for this, pretty much innocent patient, potential patient, if you will. So I think that is one of the most important things that we need to keep pushing for is more of that specialized training to help first responders. Because again, when people are in crisis, most people are going to dial 911. They don't really know what else to do. Are there other resources? Yes, but most people are not going to know how to tap into those. And it's really important that our first responders can conduct themselves in a way that's going to keep everyone safe.
No, definitely. I think, it's like you said, like partnering with those
Mm-hmm.
first responders for them to
Yes.
understand,
Yes.
to refer folks
Mm-hmm. Mm-hmm.
to
Yes.
proper care because that's
Yes.
not what you do. That's not your
Yes.
specialty.
Yes.
Um, and like I'm a big advocate for like I feel like there's certain cases where like a 302 is needed,
Mm-hmm.
but
Of course.
sometimes there's not.
Mm-hmm.
And then if that goes on somebody's record, depending on what state it is, that could really harm them in the future from
Mm-hmm.
like certain jobs, or if they try to get it off of their record, that could cost a lot of money. They'd have to hire an attorney. Um, so I feel like just really having to like first responders just need to be more aware.
Yeah. Increasing awareness and education is key because whether the person needs to be, let's say, taken to the hospital voluntarily or involuntarily, the whole process needs to be one of de-escalation and not more aggression or not misinterpreting someone's mental health crisis as meaning that they're dangerous.
Mm,
Unfortunately, there is this idea that is actually not backed up by the data that people with mental illness are dangerous, more violent, this sort of thing. And generally speaking, that's actually not true. But again, when people are approached with that type of preconceived notion, as you can imagine, it tends to result in situations escalating instead of de-escalating.
no, definitely. And I think like first responders need to partner more with therapists,
Mm-hmm.
psychiatrists,
Mm-hmm.
hospital
Yes.
entities, um, you know, folks that are private practice
Mm-hmm.
as well and have a
Mm-hmm.
list of referrals,
Mm-hmm.
so they're not taking on a role that's not theirs and like they're straight like protocols. Okay, we're going to refer. Or even if they're having in-house
Mm-hmm.
therapists or psychiatrists,
Mm-hmm.
I think that could also be something that could be good too, because they're like right on hand
Mm-hmm. Mm-hmm.
counselors,
Yeah.
but definitely referring out because
Mm-hmm.
there's folks that's their specialty. And like you said, de-escalation.
Mm-hmm.
Um, so like what role does cultural responsive mental health care play in improving outcomes, and what must clinicians do differently?
Well, again, as I was mentioning earlier about how key and important the relationship is between the clinician and the patient, if you're not culturally sensitive, if you're not culturally aware, if you are not able to connect to different cultures and respect those cultures, obviously that is going to have an adverse impact on your potential. We call it therapeutic alliance. your doctor-patient relationship, or your therapist-patient relationship. So cultural competency has been considered a core competency in psychiatry for a long time. And I think it needs to consistently be adapting and changing to the nuances of cultures. And in many instances, it's just helpful to see someone who looks like you. And so, if we can increase the representation of various ethnicities and people from different backgrounds into the mental health field, that really goes a long way.
No, definitely. I think really working on increasing representation. And I think there's also too like a lot of folks that are in the field, they just don't know about like other organizations to network. So people get the word out that, hey, I'm doing that work. I'm here.
Yes.
Because it's hard to find someone that looks like you that's providing those services that you need. Um, so like, clinicians taking that initiative to put themselves out there so folks
Yes.
can find them. Um, so also too, like at Angels Protection, we frame mental health as a public health issue. So how do you see social determinants of health, and that's including like housing, trauma, stress, poverty, motherhood, showing up in your work?
Well, one thing that I have learned over the years in my practice is I would almost dare say the majority, if not the vast majority, of people who ultimately end up seeing someone like me have trauma. Trauma is the one of the most consistent experiences that people have who end up needing mental health care. So I think that trauma informed treatment approaches are really, really important. And I think it's why certain trauma processing therapies have become more and more a part of the mainstream expectation for treatment. One example of that is a trauma reprocessing called EMDR, eye movement desensitization reprocessing. And I think if we understand that most people have some degree of trauma, of course, some more than others, being informed about that, being aware about it, asking about it, you know, I can't tell you how many times I've seen patients and I've asked about childhood trauma, sexual trauma, emotional abuse, verbal abuse, physical. They'll say, no one's ever asked me about that.
Mm.
Or they'll say, I've never talked to anyone about that, or I've never told anyone about that before. It's very sad. But I think trauma informed care is key.
No, definitely. And I think like more practitioners need to start using that trauma-informed care.
Mm-hmm.
Um, and if they're not aware about it, taking a training.
Yes, absolutely.
Because again, like you're working with folks like you never know if you're going to get someone that has been impacted by trauma. Because mental health, I feel like it's so vast.
It is.
And yeah, and it looks like so many different things for so many different folks.
Yes.
So yeah, like definitely taking initiative if you're not specialized in that. And also too, like you've worked inside hospitals, clinics, and private practice. So what systematic gaps do you see repeatedly affecting patients, especially women of color?
I would say primarily access. It's a huge problem. It continues to be a huge problem. The ways to access mental health care, even if you have good resources, like good financial resources, let's say, even then it can be very difficult. So when you also have additional barriers like transportation, housing issues, finances, so forth that interfere, it just makes it that much harder. There is a shortage of psychiatrists. There's, in many instances, a shortage of mental health professionals. In many instances, long waiting lists for various like more intensive programs. There are just a lot of barriers to care, and in addition to there just not being enough of us. So I think the solution there has to include, again, attracting more people to the field.
No, definitely, because that was going to be my next question. Like, why are these lists so long for intensive care? But due to, like you said, like there's a lack of psychiatrists. Like, there's only so many people that one person can see,
Exactly.
um, and can't like get to everybody every single day, especially when there's already clients that are currently being treated. Um, so yeah, no, definitely attracting like more folks to the field of psychiatry, and like passing that baton to them.
Yes.
Um, so like what are some of the consequences when mental health needs are overlooked during major medical encounters such as like birth, trauma, or hospitalization?
Well, I know that it's been made the awareness of maternal mortality, during childbirth and around childbirth, has become um, it's been brought to more people's attention. I think those maternal mortality rates, and there's been more attention brought to the fact that that tends to affect women of color more than others. There's lots of debate, for instance, as to why exactly that is. But given the fact that women of color who have um, physicians and other people working with them who are also of color have better outcomes, it leads one to believe that there must be some sort of either cultural or other kind of barrier there that is not allowing people to understand, for instance, that Black women feel pain just as much as anyone else. There's this misnomer, misconception, even within the medical community that has been there for years. It's only slowly starting to change. These misconceptions about um, people of color experiencing pain differently or having thicker skin or just different things that can lead to them being overlooked when there are clear signs that there's a problem. And that is what can lead to things going too far before they're noticed to be able to sometimes even save mothers. I think in the hospital, the biggest thing that I have seen is a tendency for people of color to be quickly diagnosed with more severe mental health issues that may not necessarily be warranted, and are better reserved for getting to know people over time. For instance, there has been over the decades more of a tendency for people of color to be diagnosed as schizophrenic as opposed to bipolar disorder or some other conditions, even when presenting with the same symptoms as, let's say, a white counterpart who does not tend to get diagnosed with schizophrenia. So there's clearly some sort of bias, systemically going on there as well that we're trying to understand better. I think if we can try to apply what we know accurately without bias, that would be helpful, of course. And that's also where that cultural competency comes in.
No, definitely. And I think
Mhm.
that like also stems back to your point of like more representation in the hospitals.
Absolutely.
Um, just across the board. So like our nurses, our medical assistants, our psychiatrists, the doctors that are birthing the baby
Mhm.
right
Mhm.
there. You know, Mom having access to a doula or
Mhm.
childbirth
Mhm.
educators. Even the folks that are doing the research and taking all the data from the
Yes.
hospitals,
Yes.
the representation in that sector as well too. Um, I think could, really change the trajectory of what's going on across the board in public health and healthcare systems.
Yes.
Um, so also too, like many of our listeners are navigating
Mhm.
motherhood, school, careers, and trauma simultaneously.
Mhm.
So what guidance would you offer to women who feel overwhelmed or unheard?
I think the key would be to go against that somewhat culturally ingrained idea that we were referencing earlier about needing to be strong, that showing emotions is a weakness, asking for help is seen as a weakness, that you've got to be everything for everybody. I think the guidance would be to not be afraid to reach out for help, to not consider that to be a weakness, consider that to be a strength. Sometimes when I've worked with people who are particularly reluctant to seek help or continue to accept help, I try to come to meet them where they are. So, for instance, if someone has a very strong faith, strong religious or spiritual background, I'll try to tie into that. Say, for instance, you know, God made psychiatrists. He made this earth, he made these medicines, available. There are resources here that you can use, that are here for you. You don't have to rely only on your prayer. So it is okay to accept some help and to accept those resources, that are here, as we talked about, sometimes access can be an issue, but that are here, and people need to be willing to accept them. So again, if they're feeling overwhelmed and unheard, they need to be willing to reach out, ask for help, look for support, and really demand it.
No, definitely. And I think that like starts like with, especially like if you know that you need mental health treatment,
Mhm.
being your own advocate.
Yes,
So like
absolutely.
first saying to yourself, okay, well, I know I need these services, but what are my needs?
Hmm.
And like you really need to figure out what your needs are, what do you want? And then seek and find those services out
Yes.
for yourself. Um, whether that's like, okay, I know that I need mental health services, but I do not have health insurance.
Hmm. Hmm.
So, and I can't pay out of pocket.
Hmm.
So, how can I acquire health insurance so I can support that need,
Hmm.
but making sure that I can obtain those mental health services? Um, or like just looking at, if it's like, okay, I have basic needs that I need,
Hmm.
whether
Hmm.
that's like food. Okay, well, where can I go? Is there a food bank around
Hmm.
or a nonprofit organization that could help me get connected to that? So, like you said, like just really being your own advocate, and speaking up for yourself.
Yes.
Um, so also too, like, how can future psychiatrists, therapists, and advocates learn from the leadership model you've built? One based on compassion, evidence, and partnership.
Well, again, I think the key would be to focus on some of the um, major barriers to people getting the help that they need. I think it requires focusing on just the basic premise of empathy for others. You mentioned compassion, and we've talked again several times about cultural competency, mixed in there as well. I think when you see people who have successfully bridged that gap, been active in their communities, and have helped to reduce the stigma, it really inspires, and it serves as a path for others to follow, as well.
No, definitely. And just like I think also too, like mentorship is great. Like folks seeking out like
Mm-hmm.
mentorship,
Yes.
um, programs that can connect them to fields that they are interested in, um, and like other organizations where they could hold membership in, and be a part of like using their voice,
Absolutely.
and connecting to other folks that are in the field, is great. Um, and also too, like, what gives you hope about the future of mental health care in this country?
Well, how would I put it? I would say that again, the overall trends have been encouraging in that the stigma has gone down significantly across the board. it's not unusual now for people at work to say, "Oh, I'm on this medicine. What are you on?" kind of thing, where people just are more open and discussing, "Oh, I have a therapist," or this type of thing. So I think that is extremely a really encouraging, inspiring trend, that I've seen over the years that gives me hope. Um, I don't know how some of these more major systemic kind of problems will ultimately be solved, but on small scales, I've seen, um, again, inspiring situations where people were able to overcome those barriers, and get the help that they need and bring others along. For instance, through mental health support groups. Um, and I am also hopeful that health in general, healthcare in this country will um, become less profit driven and more people centered. I think if the profit motive is removed from the situation, people will get overall better care.
No, definitely. I think removing profit is important. It's really important, especially when it comes to like mental health and psychiatry.
Yes.
Um, if it's like insurance funding or
Mhm.
grants,
Mhm.
private pay, um, there's a lot of barriers to receiving that care. Um, and then there's also like a lot of different, I've noticed like job positions regarding mental health and
Mhm.
like different like work that people are doing, whether it's like policy, or like that direct care, but yeah,
Mhm.
removing profit from it, because then it's like, okay, you're playing on a issue that folks are dealing with traumatically. So that's definitely a key. Um, and then that like ties into my next question. If you could redesign the mental health system from the ground up, what values would you embed at its core?
Well, I think some of what we've already talked about, which would be reducing stigma, educating people more about it, accepting people where they are, less of the judgment, less of the labeling, um, health equity just in general, including people, having, again, more people involved that look like other people who are needing to receive those services. And of course, just empathy. That's gotta be key.
No, definitely empathy. And I think that's like important, like with providers too, especially if you don't look like the folks that you're predominantly serving,
Mhm.
having empathy towards the scenarios that they're going through. And like what you touched on earlier, how there's different, how predominantly the Black community, they're getting diagnosed with schizophrenia,
Mhm.
instead of like bipolar disorder.
Mhm.
Um, so just having empathy towards folks' situations and just being careful in your practice, um, dealing with different folks. So I could definitely see that. And then also, like, what's one message you want young women of color, especially those facing systematic barriers, to take away from today's conversation?
Well, I think it would be to believe in yourself and to seek out the resources and support that you need, to not be afraid to do that, to not be reluctant to do that, because those resources are out there, but you have to pursue them. And as you were talking earlier, you have to be your own advocate, in order to take advantage of those.
No, definitely.
Mhm.
You have to constantly advocate for yourself,
Mhm.
for your treatment plans.
Mhm.
Um, even if like and there's some things that you just can't not get in your service treatment plans.
Mhm. Yes.
But you can speak up for yourself and say, okay, well, like, what is this type of medication? What
Mhm.
does it do for me? What is the benefit of it? Um, if you're being diagnosed with a certain disorder, asking questions about that disorder,
Mhm.
um, and not just like accepting it straight off of the bat, but saying, okay, why did you diagnose me with this?
Mm-hmm.
Um, and that just like builds that like self-resilience too, I think.
Mm-hmm.
Um, and also too, like, how can listeners stay connected to your work or access resources that reflect your approach to whole person healing?
I was trying to think of that when we had mentioned something like that earlier. Certainly keeping connected via social media is good, things like LinkedIn. I was also thinking about just local resources. For instance, the National Alliance on Mental Illness is kind of like a grassroots organization that helps people who have family members with severe and persistent mental illnesses like bipolar disorder, schizophrenia, for instance. I think that the American Psychiatric Association, American Psychological Association, psychologytoday.com. There are a number of different national resources like that that can be very useful. Um, I think that as you were mentioning, involvement in um, groups or societies. Again, there is a Bipolar and Depression Support Alliance. It has a network of support groups for people with depression, for instance. There's self-help groups for various different kind of focuses on certain diagnoses, for instance, or it can be just sort of a um, heterogeneous group of people that can support each other. One thing we didn't really touch on today, which is how prominent substance abuse tends to be, and how it tends to go hand in hand with a number of mental health issues. Tapping into those kind of resources is important as well. There's government resources that can be helpful with that. One is coming to mind right now. It's called SAMHSA. I'm trying to remember what the acronym stands for, but it's for substance abuse resources. And yeah, I just think we've been mentioning several times about awareness, reducing stigma, empathy, and advocating.
No,
I think those are
definitely.
key. Mm-hmm.
And heavy on advocating for yourself,
Yes. Yes.
and finding groups that and resources that empower you.
Yes.
That's really important because if you're in a space where you feel empowered, you want to continue
Mm-hmm.
to do that great work for yourself
Yes.
to get better. Um, and then also like separating mental health from substance abuse disorder as well too. We didn't, like you said, didn't touch too much on that, but they do go hand in hand, but they're very
Mm-hmm.
separate.
Mm-hmm.
um, and sometimes folks could blend the two
Mm-hmm.
because sometimes it could be hard to separate it. But that's a great point that you made on
Mm-hmm.
that as well. Um, so like now I just want to thank you,
Mm-hmm.
Dr. Williams, for joining us today on the podcast. And just thank you so much for your leadership, your service, and your unwavering commitment to healing with integrity, depth, and humility. And your work reminds us that mental health care should honor the whole person, just their story, their strength, and their path to wellness. So for those listening, if you feel moved to take action or seek support, visit angelsprotection.org to learn more about our projects and programs for the upcoming 2026 to 2027 year initiatives for young women aged 13 to 20. And always remember, silence protects systems, not people. So let's keep breaking it together.
Thank you.